Welcome to this roundtable discussion on the human brain, a cornerstone of scientific inquiry that continues to challenge our understanding. As we navigate these complex topics, we are joined by a distinguished panel, each bringing unique insights into the neurological sciences.
It's crucial to recognize the strides we've made in brain mapping techniques. These aren't just academic exercises, they're gateways to unlocking mysteries of the human mind.
While I commend the advancements in neuroimaging, let's not overlook the need for precision in our techniques. An inaccurate map can mislead more than it informs.
That's a valid point, Ted. Precision in brain mapping directly impacts clinical outcomes, especially when it comes to diagnosing and treating neurological disorders.
The conversation around brain mapping is incomplete without addressing its implications for psychiatric treatment. We're seeing a blurring of the lines between neurology and psychiatry, making this an exciting time in the field.
Absolutely. And from a pharmacological perspective, these advancements could revolutionize how we approach medication development, especially when considering neuroplasticity.
It's essential, however, not to get ahead of ourselves. Surgical outcomes depend on the accuracy of these maps, and a slight misstep can have significant consequences. I agree with Tasha, yet it's also important to acknowledge how far we've come. The potential to improve patient care is enormous.
Thank you all for those introductions to your perspectives and the passion you bring to your fields. Today, we're set to explore some of the most contentious and promising areas of neuroscience. Let's dive into these discussions, always remembering the impact our work has on human lives. Let's dive into the brain mapping techniques that have significantly advanced our understanding of the human brain. Mike, your recent work has been pivotal. Could you start us off?
Absolutely, Laura. The introduction of high-resolution magnetic resonance imaging, or MRI, has radically changed our approach to understanding brain structure and function. We're now able to visualize and analyze the brain in ways that were inconceivable a decade ago.
I have to jump in here, Mike. While MRI advancements are substantial, the real game changer has been the development of functional MRI, fMRI. By observing blood flow, we can now see the brain in action, not just static structures. It's a crucial distinction when discussing advancements in brain mapping.
Ted makes a valuable point on fMRI. However, it's the integration of these imaging techniques with advancements in computational neuroscience that truly pushes the envelope. This synthesis allows for the creation of detailed brain maps that inform both our basic understanding and clinical approaches.
Ted, from a neuroradiology perspective, how do these advancements influence your field directly?
They're transformative, Laura. But it's critical to note that technology is only as good as its application. The precision in imaging nowadays aids in pinpointing abnormalities at their earliest stages, revolutionizing how we diagnose and propose treatments for neurological disorders.
Speaking of clinical relevance, how do you see these advancements impacting neurological disorders?
The evolution of brain mapping techniques has been particularly promising for understanding the pathophysiology of various neurodegenerative diseases. Identifying specific biomarkers for diseases like Alzheimer's at an earlier stage could potentially revolutionize treatment plans and outcomes.
And it's not just neurodegenerative diseases. In neuroradiology, we're better equipped than ever before to understand the complexities of the vascular system within the brain, leading to improved interventions for stroke victims.
It sounds like both of you are highlighting the potential of these techniques to vastly improve patient outcomes through earlier and more accurate diagnoses.
Precisely, Laura. Early detection is crucial, and the advancements in brain mapping are a monumental step forward.
I'd stress, though, that while the advancements are impressive, there's an imperative need for clinicians to stay current with these technologies to fully utilize their capabilities in patient care.
I couldn't agree more, Ted. The pace at these technologies evolve demands continual education and adaptation. It's the only way we can ensure these advancements fully benefit patient care and outcomes.
It's clear that the collaboration between neuropathology and neuroradiology, driven by these advancements, has the potential to considerably advance our understanding and treatment of neurological disorders. Thank you both for your insights. Let's delve into the intricate world of neuroplasticity. How recent findings in this area are changing our approach to treatment and recovery. Arthur, can you start us off with your insights from a psychiatric perspective?
Certainly, Laura. The concept of neuroplasticity is revolutionary for psychiatry. For decades, we've seen mental illness as often a life sentence, unchangeable and unyielding. But understanding that the brain can rewire itself, form new connections, means we now see potential for treatments that were previously unimaginable. Cognitive behavioral therapy, for instance, has shown remarkable results by leveraging neuroplasticity, enabling patients to literally change their brain's structure and function by altering their thoughts and behaviors.
That's a compelling point, Arthur, and it aligns with recent advances in pharmacology as well. There's a symbiotic relationship between neuroplasticity and pharmaceuticals. Medications provide the biochemical environment that supports neuroplastic changes, especially in the context of depression and anxiety disorders. By modulating neurotransmitter levels, we're not just treating symptoms, we're facilitating the brain's natural ability to reorganize and heal.
While I appreciate the perspectives on psychiatry and pharmacology, from a neurosurgical standpoint, the implications of neuroplasticity are also profound. We used to think the brain's map was almost set in stone, except in early childhood. Now we're observing how the brain can reroute functions around damaged areas, which has enormous implications for rehabilitation post-surgery. Techniques like transcranial magnetic stimulation and targeted rehabilitation can encourage this rewiring, improving outcomes for patients who've suffered strokes or traumatic brain injuries.
Tasha, you're highlighting an essential aspect: rehabilitation. However, it's crucial to recognize that while the brain has this remarkable capacity for change, the environment and ongoing therapy play a pivotal role.
Absolutely, but let's not overstate the pharmaceutical industry's current achievements. The treatments work, yes, but they're not without their limitations and side effects. The precise mechanisms by which they enhance neuroplasticity are not fully understood. We need more targeted therapies that can more directly and safely influence neuroplastic processes.
William brings up a valid criticism, and that's where the interplay between different specialties becomes vital. Understanding the biochemical underpinnings of neuroplasticity can guide the development of better psychiatric treatments with fewer side effects.
And on that note, advances in neuroimaging have been invaluable. They allow us to see the effects of neuroplasticity in real time, providing empirical evidence that the brain can and does change in response to therapy, medication, and surgical interventions.
This discussion underscores the importance of an interdisciplinary approach. Each field contributes a piece to the puzzle of neuroplasticity, from surgical techniques and pharmaceutical interventions to psychiatric treatments. It's clear we're just scratching the surface of what's possible when we leverage the brain's capacity for change. Let's dive into a critical aspect of brain health, the intersection of neurology and psychiatry in treating brain disorders. We've all seen considerable overlap in our work. Arthur, could you kick us off with your perspective from psychiatry?
Absolutely. The divide between neurology and psychiatry is, in many ways, artificial. Conditions like depression and schizophrenia have clear neurological underpinnings. Treatment plans that consider both neurological and psychiatric aspects tend to have better outcomes. It's about treating the whole patient.
That's a good point, Arthur. However, we can't overlook the importance of precise diagnostics here. Imaging helps us see that some psychiatric conditions have neurologic causes. Take temporal lobe epilepsy, often misdiagnosed as psychosis. We need both perspectives to correctly identify and treat these conditions.
Ted, your emphasis on diagnostics underscores a critical synergy. It's this kind of collaboration that can lead to groundbreaking treatments.
But let's not get ahead of ourselves. While neuroimaging has indeed advanced, it's not a panacea. The risk of over-reliance is diagnosing based on images alone without considering the patient's psychological state, a potentially dangerous path.
Arthur, while I agree with you on the risk of over-reliance, dismissing the technological advancements in diagnostics undermines the strides we've made in treatment precision.
Both of you make valid points. There's a balance to be struck between leveraging technology and maintaining a holistic approach to patient care.
Precisely. And it's through collaboration that we find this balance. Psychiatry and neurology, working together, can create more nuanced and effective treatment plans.
Collaboration and balance. Indeed. This is why discussions like this are invaluable, bridging gaps and fostering understanding across specialties. Let's shift our focus to neurosurgical procedures for brain tumors, which have seen significant advancements. Tasha, could you start us off with your insights on the latest surgical techniques?
Absolutely. We're entering an era where the precision of neurosurgery has dramatically increased, thanks to technologies like intraoperative MRI. This allows us to see the tumor in real time during surgery, effectively increasing the safety and success rates of complex procedures. And from a neuropathological standpoint, understanding the molecular and genetic basis of brain tumors has been crucial. It's not just about removing the tumor, it's about understanding its behavior for better postoperative care and targeted therapy. Mike, that's an excellent point. The integration of neuropathology into surgical planning cannot be understated.
Indeed, Mike. And how do these advancements impact patient care in neurology?
They're transformative. With a deeper understanding of tumor biology, we're able to predict outcomes more accurately and tailor rehabilitation accordingly, which significantly impacts long-term care.
While these advancements are impressive, we mustn't overlook the crucial role of neuroradiology. Advanced imaging techniques are pivotal in planning these surgeries, not just during, but also in the follow-up phase, ensuring that we've achieved our objectives without compromising brain function.
Ted, I couldn't agree more. The synergy between neuroradiology and neurosurgery has never been more critical. But it's also about ensuring we're pushing forward without exposing patients to undue risk.
It seems like a delicate balance between advancement and patient safety.
Exactly, Laura. And as much as we're excited about these technological advances, we must remain vigilant. Not every new technique will be right for every patient, and it's our responsibility to navigate these decisions carefully. That's a fair point. The conversation always needs to come back to individual patient outcomes. Are we doing better by them? That remains the ultimate measure of our success.
It's clear that the advancements in neurosurgical procedures for brain tumors are not just about removing tumors more safely, but also about a comprehensive approach that includes pre-surgical planning, patient-centered decision-making, and post-operative care. Each of your fields plays a critical role in this multifaceted approach. Let's delve into the role of neuropharmacology in managing neurodegenerative diseases. This is a rapidly evolving field with significant implications for patient care. William, could you start by discussing the latest developments in this area?
Certainly. Recent advances in neuropharmacology have provided us with new drugs that target the underlying pathophysiology of neurodegenerative diseases more effectively. For instance, in Alzheimer's disease, we are seeing promising results from drugs that can reduce amyloid beta plaques in the brain. However, it's important to note that these treatments are not without challenges, especially concerning their long-term efficacy and side effects.
That's a valid point, William. In psychiatry, the management of behavioral and psychological symptoms of dementia is crucial. The medications you mentioned do offer hope, but they also raise concerns about over-medication and its impact on a patient's quality of life. It's essential to strike a balance between managing symptoms and maintaining cognitive function as much as possible.
Adding to Arthur's point, imaging technologies play a crucial role in evaluating the effectiveness of these pharmacological interventions. We've made strides in using PET scans, for example, to track amyloid and tau in the brain, which helps us understand the progression of diseases like Alzheimer's. This information is vital for assessing how drugs impact the disease course.
Ted, I agree. Imaging is invaluable, but we must not overlook the primary role of pharmacology in directly addressing neurodegeneration. The new frontier of drugs targeting tau protein pathology is an area where we expect significant breakthroughs. These treatments could truly transform the landscape of neurodegenerative disease management.
However, let's not forget the psychiatric side effects these drugs can have. A neuropharmacological intervention that's effective in slowing disease progression might simultaneously exacerbate or induce psychiatric symptoms. It's a fine line we walk in treatment.
It sounds like while we have made progress in neuropharmacology, there are still many considerations to balance regarding patient health and treatment efficacy.
Precisely. The complexity of neurodegenerative diseases requires that we approach treatment from multiple angles, including addressing the molecular cause of diseases and managing symptoms to improve patient quality of life.
I'd like to point out, from a surgical perspective, that pharmacological advances also impact the decision-making process for when to intervene surgically. Improved drug management can delay the need for surgical interventions, which is often a last resort.
And from the pathology side, understanding the disease on a molecular level is crucial for targeted drug development. The more we know about the mechanisms at play, the better we can tailor our pharmacological approaches. This underscores the need for a multidisciplinary approach in both research and treatment.
Thank you all for this insightful discussion. It's clear that while we are advancing in treating neurodegenerative diseases, there remains a need for careful consideration of the implications of these treatments, from drug efficacy and side effects to the timing of surgical interventions and the overall patient management strategy. Let's dive into the pathology of neuroinflammatory diseases. Mike, your recent work has provided significant insights. Could you share some findings with us?
Certainly, Laura. We've discovered intricate pathways that depict how inflammation in the brain isn't just a reaction, but part of the disease pathology itself, especially in conditions like multiple sclerosis and autoimmune encephalitis. These findings are reshaping our approach to these diseases at the molecular level.
That's fascinating, Mike. From a pharmacological perspective, this information is invaluable. It informs the development of targeted therapies that can more precisely modulate the inflammatory response and ideally mitigate the progression of these diseases.
While that's promising, William, the surgical angle is somewhat more guarded. In cases of severe neuroinflammation, sometimes surgical intervention is considered, though it's always a last resort. The advancements in pathology help us identify which cases might benefit from such interventions, though it's a challenging decision.
True, Tasha. And it's important we continue to refine those indicators because the risks are significant. Our goal is to ensure interventions are as targeted and minimally invasive as possible.
Ted, with your expertise in neuroradiology, how does neuroimaging contribute to our understanding and management of neuroinflammatory diseases?
Neuroimaging is critical, Laura. It helps us visualize changes in brain structure and function due to inflammation. We're not just talking about static images, but dynamic imaging that can track the progression of inflammation and the effects of treatments over time. This is revolutionary in tailoring individual patient care and monitoring disease progression.
This integration of disciplines highlights the complexity of the brain's response to inflammation. Psychiatry also benefits from these technologies, as neuroinflammation plays a role in several psychiatric conditions. Understanding the biological underpinnings assists in developing more effective treatment strategies.
I have to jump in here, Arthur. While interdisciplinary collaboration is valuable, we must not oversimplify the pharmacological challenges. The brain is remarkably complex, and drugs that look promising in theory or in vitro don't always translate to real-world effectiveness. The blood-brain barrier, for instance, remains a significant hurdle.
William makes a crucial point. Our understanding of the blood-brain barrier's role in neuroinflammation has grown, but effectively targeting it with therapeutics is an ongoing challenge. Our work in neuropathology continues to uncover how deeply interwoven these mechanisms are, demanding solutions that are as complex as the problems we aim to solve.
And from a surgical perspective, this complexity underscores the need for precision. We rely heavily on the insights from both pharmacology and pathology to guide our hand, quite literally. It's about more than just intervention. It's about precision and timing.
Clearly, the intersection of our specialties provides a more comprehensive understanding of neuroinflammatory diseases. This collaboration, albeit challenging, pushes us closer to innovative treatments that offer real hope to patients suffering from these conditions. Let's delve into the advancements in neuroimaging technologies. Ted, could you start us off by discussing their impact on diagnostic accuracy?
Certainly, Laura. Radiology has always been pivotal in diagnosing brain disorders, but recent developments have been game changers. High-definition MRI scans now allow us to see the brain's structure in incredible detail. This has not just improved our diagnostic accuracy, it's revolutionized it.
I have to interject, though. While the advancements in imaging are impressive, we cannot overlook the importance of correlating these images with clinical findings and neuropathological evidence. Without a comprehensive approach, even the most advanced imaging techniques can lead us astray.
Mike raises a valid point. However, the precision of these new imaging techniques often provides clarity in cases where traditional methods leave room for doubt. For instance, in identifying microbleeds or small lesions that were previously undetectable, our diagnosis becomes more accurate, impacting treatment plans significantly.
Arthur, from a psychiatric perspective, how do you see these imaging advancements influencing your field?
It's a double-edged sword, really. On one hand, advanced neuroimaging can illuminate the biological underpinnings of psychiatric conditions, allowing for a more nuanced understanding and treatment approach. Yet, there's a risk of over-reliance on these technologies, potentially overshadowing the importance of patient-reported symptoms and narratives.
Understandable concern, Arthur, but the precision of these advancements shouldn't be undervalued. They allow us to differentiate between psychiatric and neurological conditions with overlapping symptoms, facilitating more accurate diagnoses.
And what about the integration of this technology into treatment planning, particularly in neurology?
The impact is substantial. For instance, in planning for epilepsy surgery, fMRI and PET scans offer critical insights into brain function, guiding surgeons more effectively than ever before.
While the surgical perspective certainly benefits from these imaging advancements, it's crucial to emphasize the importance of multidisciplinary collaboration. The data from neuroimaging must be interpreted in the context of a patient's overall condition, incorporating insights from neurology, neuropathology, and beyond.
Precisely, Tasha. The advancements in neuroimaging are not just a triumph of technology, but a call for closer collaboration across specialties to leverage this technology in the most effective way possible.
Indeed, it's the integration of this technology with clinical insights that will truly advance our understanding and treatment of brain disorders. Without context, even the most detailed images are just pictures.
And let's not forget, as we become more reliant on advanced imaging, the necessity for expertise in interpreting these images grows. It underscores the importance of training and continuous education in the field.
A crucial reminder, Mike. The evolution of neuroimaging is not only impacting diagnostic accuracy and treatment, but also the education and training of future medical professionals. Our discussion highlights the need for a balanced multidisciplinary approach, utilizing these advancements not as a crutch, but as a tool, integrated with the breadth of medical knowledge and patient care. Let's dive into the burgeoning field of gene therapy and its role in treating genetic brain disorders. William, can you kick us off with your insights on the current state and future of gene therapy?
Absolutely, Laura. The potential of gene therapy is monumental. We're looking at fundamentally altering the treatment landscape for genetic brain disorders. Recent trials have shown promising results in diseases like spinal muscular atrophy, SMA, and certain forms of Leber's hereditary optic neuropathy. However, the real challenge remains in delivery mechanisms, ensuring the therapeutic genes reach the targeted brain cells without adverse effects.
I'd like to build on William's point. From a neuropathological perspective, understanding the disease at a molecular level is crucial. Gene therapy offers hope not just in treating symptoms, but in addressing the root cause of genetic diseases. However, the complexity of the brain's structure and its protective barriers makes delivery a significant hurdle to overcome. And that's where advances in neurosurgery could play a pivotal role. Techniques like convection-enhanced delivery are being explored to bypass the blood-brain barrier. It's a promising synergy between gene therapy and neurosurgery, offering precision targeting of affected areas.
Tasha makes an important point about the synergy between fields. Arthur, from a psychiatric standpoint, what implications does gene therapy hold?
It's intriguing, Laura. The prospect of gene therapy in treating brain disorders that have psychiatric manifestations is revolutionary. It presents a paradigm shift from managing symptoms to potentially offering curative treatments. However, ethical considerations about gene editing in psychiatric conditions must be carefully navigated. The line between treatment and enhancement can become blurred.
While ethical considerations are valid, the danger is in the paralysis by analysis. The focus must remain on the immense potential gene therapy holds in alleviating human suffering from debilitating genetic disorders.
Agreed, but cautious optimism is key. The long-term effects and potential unintended consequences of gene editing are areas that need more research. Our excitement for the revolutionary potential should not make us overlook the rigorous scrutiny required. Indeed, and let's not underestimate the role of technological advancements in neurosurgery that will be critical in the safe deployment of gene therapies. Precision and safety are paramount.
It's clear that interdisciplinary collaboration will be crucial as we advance. Gene therapy's potential in treating genetic brain disorders is immense, but the journey is complex and fraught with both scientific and ethical challenges. Thank you all for such a vibrant discussion. Let's dive into the ethical dilemmas and future directions of brain-computer interface technology. Arthur, can you kick us off with your thoughts on the ethical considerations?
Certainly. The integration of brain-computer interfaces, BCIs, raises profound ethical questions, particularly concerning privacy and autonomy. If we can access and interpret someone's brain activity, where do we draw the line on personal privacy? The potential for misuse is vast and concerning.
I must interject with a technical perspective. The precision of neuroimaging has grown, but interpreting complex thoughts or intentions from this data isn't as straightforward as you suggest. The technological leap to where privacy becomes a concern is significant and not imminent.
While I recognize the current technological limitations, Ted, the trajectory we're on suggests it's a matter of when, not if. We cannot afford to be complacent about ethical frameworks.
Moving from ethics to application, how do these interfaces stand to change patient care?
The potential for BCIs to restore function for patients with neurological deficits is enormous. For example, restoring mobility or communication for individuals with severe physical impairments offers a new lease on life. The positive implications cannot be understated. I agree with Tasha, but we must also consider the risks of surgical implantation of these devices. Infections, rejection, and long-term effects on brain tissue are all serious concerns that need addressing alongside the technological advancements.
Ted, can you speak to how neuroimaging supports BCI development?
Absolutely, Laura. The advancements in neuroimaging, particularly in functional MRI and PET scans, allow us to better understand brain activity patterns related to specific thoughts and movements. This understanding is crucial for the development of BCIs that can accurately translate thought into action.
Yet, the psychiatric implications of being connected to a machine cannot be overlooked. The impact on an individual's sense of self and the potential for dependency on technology for basic functions presents new challenges for mental health professionals.
That's an important point, Arthur. However, the flip side is the role of BCIs in potentially treating psychiatric disorders. Imagine depression or PTSD treatments targeted directly to brain activity, minimizing side effects associated with traditional pharmaceuticals.
Integration of BCIs in neurosurgery also promises precise interventions, reducing risks during operations. The potential to map the brain in real time during surgery could significantly enhance outcomes. But let's not rush without fully understanding the long-term effects. Accelerated adoption of BCIs without comprehensive studies could lead to unforeseen consequences, overshadowing the benefits.
It seems clear that while brain-computer interface technology holds remarkable promise for the future of medicine and beyond, it is not without its ethical, technical, and health-related challenges. This underscores the importance of interdisciplinary collaboration as we navigate this frontier. Thank you for a spirited discussion, everyone. Let's delve into the impact of lifestyle on brain health. William, could you start us off with your perspective from neuropharmacology?
Certainly, Laura. The conversation around lifestyle and brain health isn't complete without addressing the pharmacological aspect. Various drugs, whether they're prescribed medications or substances of abuse, have profound effects on our brain health. For instance, the chronic use of opioids can severely impact brain function and structure, underscoring the importance of a healthy lifestyle.
And from a neurosurgical standpoint, lifestyle plays a critical role not just in prevention, but in recovery as well. Patients with healthier lifestyles tend to have better outcomes after surgery, partly due to better overall brain health. It's an aspect we cannot overlook. I'd like to emphasize William's point on drugs, but from a pathological viewpoint. Our findings consistently show the negative impacts of poor lifestyle choices, like drug abuse or even neglecting physical exercise, on the brain's health. It's fascinating yet alarming how much our choices can directly affect brain pathology.
Indeed, Mike, and when you consider the role of neuroprotective drugs in possibly mitigating some of these effects, the intersection between lifestyle, pharmacology, and pathology becomes even more critical.
While I agree with the points made, it's essential to understand that from a psychiatric perspective, the conversation around lifestyle and brain health is nuanced. For instance, the impact of stress, which can be both a lifestyle factor and a neurological symptom, is profound. Managing stress through techniques like mindfulness or cognitive behavioral therapy can have significant neuroprotective effects.
Ted, any thoughts on how imaging has contributed to our understanding of lifestyle impacts on the brain?
Absolutely, Laura. Neuroimaging has been pivotal in illustrating the tangible effects of certain lifestyles on the brain. We've seen how substance abuse physically alters brain structures, but we've also observed the positive effects of exercise, for example, in enhancing brain plasticity. This provides a compelling visual argument for the adoption of healthier lifestyles.
Ted, your point about brain plasticity is crucial. Post-operative recovery is intricately linked to how adaptable the brain is, and lifestyle factors are key to maximizing this adaptability.
Yet, let's not forget the importance of a balanced diet. Recent research has begun to unravel the complex ways in which micronutrients affect brain function and how imbalances can contribute to neurodegenerative diseases. It's an area ripe for further exploration.
And on that note, William, the neuropathological evidence supporting the role of diet and exercise in mitigating Alzheimer's and other neurodegenerative conditions is growing. It reinforces the importance of considering our lifestyle choices as part of a comprehensive approach to brain health.
There's a tendency to overlook the psychological benefits of these lifestyle factors, though. Regular exercise, social engagement, and a balanced diet are not just good for the brain biologically, but are also crucial in maintaining mental health.
It's clear from our discussion that the link between lifestyle and brain health is multifaceted, touching on every aspect of our areas of expertise. The contributions from neuropharmacology, neurosurgery, neuropathology, neuroradiology, and psychiatry highlight the importance of a multidisciplinary approach to promoting brain health through lifestyle. Let's take a moment to reflect on the insights we've shared today. I'd like each of you to highlight what you see as a pivotal point of our discussion or a particular topic that resonates with you as we look toward the future of brain science.
I've been particularly struck by the discussions around the advancements in brain mapping techniques. The potential these tools hold for uncovering new layers of understanding in neuropathology is vast. However, Ted made an excellent point on how integrating these advancements with neuroradiology is critical. Without such integration, we risk overlooking the functional applications of these findings.
Precisely, Mike. And while I appreciate the significance of integration, I must emphasize the transformative potential of neuroimaging in our field. Arthur's insights into the psychiatric applications of these imaging techniques underscore an oft-overlooked dimension. that understanding the brain's structure is inseparable from understanding its function and disorders.
Thank you, Ted. The intersection of neurology and psychiatry is indeed an area ripe for exploration, as Laura underscored. It's not just about the physical or the mental, it's about the complex interplay between the two. And here, I believe, lies the heart of future breakthroughs in treating brain disorders. However, I must assert, while collaborations are promising, the challenge remains in ensuring these interdisciplinary efforts are truly integrated and not merely parallel tracks.
I'm glad Arthur brought up integration because it directly ties into my enthusiasm for the developments in neurosurgery, especially regarding neuroplasticity. Williams' commentary on pharmaceuticals' role in enhancing neuroplastic processes was enlightening. It's crucial, however, to remember the surgical angle, where we're not just correcting deficiencies, but actively enhancing the brain's capacity to heal and reorganize itself. This is where real progress is made, but it requires a deep understanding of both the biological and pharmacological realms.
Tasha makes an invaluable point on the need for a multidisciplinary approach. My take from today's conversation is the urgent need to better understand the neuropharmacological management of neurodegenerative diseases. As Arthur and Mike have shown, neuropharmacology doesn't exist in a vacuum. It's part of a continuum of care that spans pathology, surgery, and beyond. The future of brain health isn't just in new drugs, but in how these drugs are part of comprehensive treatment strategies.
I'm heartened by your reflections and the depth of our discussion today. Each of you brings a unique perspective, yet there's a common thread underscoring our dialogue: the conviction that advancing brain health demands a symbiotic approach across specialties. Our debate has been spirited, yes, but it's clear that such passion is fueled by a shared commitment to pushing the boundaries of what's possible in brain science and treatment. Let's take this commitment forward, continuing to challenge, question, and inspire each other in our respective fields. Thank you, everyone, for an enriching discussion.